The first thing that comes to mind for me when people ask, like, what is vision therapy or what do you do? I usually describe it as physical therapy, but for your eyes. Or and I've also started using recently saying it's kind of like going to the gym, but for your eyeballs. And so we're really strengthening all of the different aspects of your vision.
Some of the signs that are maybe less obvious are reading and learning difficulties or challenges with attention. I think those things often get attributed to dyslexia or ADHD, and those things certainly exist. They can certainly cause those symptoms and concerns. But there's a very similar presentation with some visual challenges as well. So I think it's really important to also rule out whether or not vision is contributing to those concerns as well.
I always like to ask about homework over the week. Like, were they able to get their home vision exercises done? Then after that, we immediately jump into our activities for the day. I usually like to do about 4 or 5 with each one of my patients. And it's a good mix of fun movement activities, but also good challenging ones for them too. And throughout, just trying to emphasize education for them as well. So that making sure they understand why we're doing these exercises and what skill we might be working on. And typically, what our kids enjoy the most are those fun movement activities. And also earning stickers or stamps to be able to turn in for prizes at the end of the session for working hard or reaching different milestones too. Up to me the most right now is a patient that I'm currently working with who he's been in vision therapy for about 2 months now. He just turned 7 years old. And when he came in, he was having a lot of difficulty with all aspects of school, whether it was reading or math. And not only with the academic part, but also the social and emotional part. So he was very upset a lot of the times, very sad about how he was performing versus his peers and just wasn't able to be confident in himself. His dad was a professional baseball player and, of course, wanted his son to be very involved in sports as well, but he had no interest in sports involving a ball. But since starting vision therapy, within the first 2 or 3 sessions, mom saw an immediate change in his demeanor and his confidence. He was asking mom, when can I start baseball? When can I start basketball? And his teachers as well saw a huge change in him as far as how he was interacting with his friends, him starting to excel in subjects that he was not doing well in before. And then each week, I feel like when I work with them, I'm getting new updates from mom, like, oh, this one thing got so much better, this thing. And so just seeing such a profound impact on him at such an early stage in his therapy journey has been incredible to see. And also just nice to know that we have played a part in that too for him.
The question that I typically get the most often is, why didn't I know about this sooner? Which is a very hard question to answer gracefully because I don't ever want to speak on the behalf of other providers or other places that they've been in the past. But I always like to reassure parents or patients that the past is the past, but you're here now, and we're concerned about how we're going to change what's going to happen in the future. And that's the most important part. So you're here now, we'll figure it out. To be as transparent as possible with my patients and my parents. Usually I put people into 3 different categories. There's either the, yes, we see this all the time, this will absolutely help. Sometimes there's a middle ground of, this might help if you're willing to try it. It's not going to hurt anything, but we are willing to try if you are. There are even a couple of folks who I've said, this is not the answer to what you're coming here for. And that's not to be, pessimistic or discouraging, but I just like to be very upfront and transparent so that the expectations are realistic. But for those folks or those kiddos who are coming in with those conditions that we see and treat consistently and regularly, I just try to reassure the parents of that and even tell them some other stories, about other kids that we've had with great success that are in a similar situation as their child. Between vision and eyesight, we always say that there is so much more to vision than seeing 20/20. It's important to see 20/20. It's important to have healthy eyes, but we want to know, how are you functioning with your vision? Because you can see 20/20, but you can be seeing double while reading that 20/20 line. Or maybe you can see 20/20 sometimes, but that clarity is going in and out of focus because your focusing system. Or maybe you can see 20/20, but your eyes are jumping around across the line of letters and you're not able to read them in order. Maybe you can see 20/20, but your brain isn't processing correctly the letters that you're reading on that line. So there is so much more to vision than just seeing 20/20. There's more to vision than just eyesight, so to speak. And then the other myth that I want to clear up that I hear way too often is that vision therapy does not work. Does it work for everything? No, it is not a catch-all, but for the things that it is designed for, it absolutely does. And I get to see that here every single day, which is one of the many reasons why I love it.
So one moment, or I guess milestone, for one of my patients that really stands out. This is a patient who I've been seeing for a long time now, and it's been definitely a difficult journey for both of us within therapy. Getting to therapy is always difficult. Doing exercises in the therapy room can be difficult for this patient, but we've been working a lot on his reading skills, and other visual skills as well that tie in with reading. And recently, within the last couple weeks, mom has shared with me that even though he's in first grade, he's now reading at a third grade level. And for me, reflecting on this patient who has struggled so hard just to be able to sit down and do a worksheet or do an exercise, and now he's excelling at this skill that we worked so hard on. It's just been so impactful, and it made me really proud to think that I played a part in that, and that he's come so far as well.
Okay, mine's more vague. Because it's really hard for me to pick just one. I feel like there are so many little moments throughout the day that just make me really grateful to be here. And in particular, to work with kids, I just think they're just really fun. I had a kid the other day who kept looking at me and saying, "I think I'm getting used to you," which isn't quite a compliment, but I'll take it. Or a kiddo the other day who said, "So you see everybody that comes here, like you check everybody's eyes?" And I said, "Yes, I do." And she said, "So you're like famous?" And I said, "Yes, I am." It's moments like that just really make me grateful. But a more general one too, we have a lot of adults in particular who, after coming here, say that they finally feel seen. They've had these concerns. They feel like they haven't been addressed or fully uncovered in the past, and they finally feel like they're at the root of what's going on and getting what they need, which is very rewarding.
So I think from the very beginning, when they first walk in the door, we do our best to create a very warm and supportive environment. I think from when you walk in and see Ed at the front desk, or when you're being taken back with Miss Haley or Dr. Browne, or coming back for your first vision therapy session, we want to make sure everyone feels very accepted, regardless of why they're coming here. And I know in the therapy room as well, we really try and foster an environment where it's okay to make mistakes. Not only is it okay, but it's actually encouraged to mess up and make mistakes. And that way we can all feel a little bit more comfortable around the harder exercises that we might have to do throughout the session. And two, whenever people come in for their first session, I'm always trying to have fun with my patients. So we're going to do some really fun games together, move our bodies around, and while still getting to know each other as well. And then on the parent side, when our parents come back for our first session, I'm always trying to make sure they're involved in the exercises as well. So they get to put on the fun red and green glasses or try out all these different tools that we're doing too, just to make it feel like a much more collaborative session. And they also get to learn too, this is what my child is going to be doing, to hopefully quell any sort of reservations or nervousness that they might have around what vision therapy is really like.
And on my end, when I'm usually one of the first people that the patient sees, whether it's Haley or myself, when they come in for their initial evaluation. So I always tell people that it's kind of like an eye exam that they've had before. Some of it is familiar. A lot of it's going to be very new. For both kids and adults, I like to explain what's about to happen before I do it so that there are no surprises. And then for kiddos in particular, we often have a stuffed animal friend join us. I will oftentimes check the stuffed animal's eyes and then the kiddo's eyes so they can even see exactly what I'm about to do to see, oh, that's not scary at all. And then we can check their eyes. And then sometimes I let them check mine too. So we just have a lot going on in there, but everyone usually feels pretty comfortable.
Adults in general, we definitely have to take a different approach too, especially those with traumatic brain injuries. And my first thought when working with an adult is that I want to make sure that we're educating them as much as possible about what we're doing inside the therapy room, each exercise, and also making sure we're always creating or going back to our goals for the therapy program too. So making sure everything that I'm doing is lining up with them and what they want to accomplish throughout the program. And then with our traumatic brain injury patients, they're coming in still trying to adjust to a new normal after what happened to them. And so it's a lot of compassion and listening, especially at the beginning, about what's going on, and really trying to dig deep into how can we make their brain and their eyes and the connection between the two stronger, and trying to get them as close to that normal that they used to have as well. They're still some of my favorite patients to work with because the improvements that we see are just so incredible. And really it is an emotional journey, I think, for us as the therapist, but also for the patient too, when we do see all that progress, looking at where they came in versus where they are after the program is. So I worked with a patient a while back. He was a student in college when he got into a car accident. After the car accident, he suffered a concussion from the accident that was very debilitating for him. He wasn't able to go to class without severe headaches or nausea, dizziness. He'd wake up every morning extremely nauseous, throwing up. He just could not function as not only a college student, but just a person anymore because of the injury. Thankfully, he was able to find us and start therapy through us. And when I first met him, he was very down, as you would be after an accident like that, after that big change in your life. But over the months that we worked together, you could see his personality start to lighten up, where he really became in the office such a big light in the office, cheering everybody up, just having a great attitude in general. And by the end of his program, he wasn't suffering from any nausea anymore. He was able to be a full-time student back in college and pursuing the degree that he wanted to, and just got back to his normal life. And so seeing that long progression from where he came in versus where he left was just so impactful. It makes me so happy to think that he was able to get his life back after everything that happened. My first one is a sense of relief So after everything that they've been fighting, whether it be a kiddo who's been struggling in school for a long time, not being able to participate in sports, or an adult who's been struggling with something their whole life, in regards to their vision, they can finally feel some sort of sense of relief that they're free of that burden of those deficiencies now, and they can move on and live their life without those holding them down anymore. And also with that, just gaining their confidence back. So leaving here feeling confident that they can go out and do their job, take care of their families, perform in school, just feel better overall.
And I think my biggest takeaway is I hope that people feel cared for. Um, we put a lot of time and energy and love into our patients. And I think a lot of people do recognize that when they're here. They get a lot more face-to-face time with us than maybe some other places. But there's not just the face-to-face time. There's so much that goes in behind the scenes that people may or may not know about, because we are wanting the best for our patients and we're trying to do everything that we can to accomplish that. So I hope that people feel genuinely cared for here, because they are.
The biggest one for me that came to mind was showing patience and trust in the process. I think with anything with learning, but especially visual learning, it takes time to rewire the brain and develop that visual skills that we might not have had before, or visual skills that we lost due to an injury or an accident. So progress can take time, but at the end of it all, if you show that patience and trusting the process, you're really going to see the fruits of all your labor, and just know the huge impact that vision therapy had on you and your vision as well.
My advice is to just do it and just commit to it. It is a commitment. We are not, we know that. We know it's a commitment, but it's such an important one. You have one life, one set of eyes. So much of what we do every day is driven by our vision. And a lot of people don't have the opportunity to do vision therapy or to address these visual deficits or symptoms. I know I didn't, and I wish I would have as a child. It's something that I think about often in this role here. So just do it, give it the time and the energy it needs. It feels like a never ending process sometimes when you're in it, but there is an end in sight, and the benefits from it are going to last the rest of your life. So just do it.